Okay, shall we start now? Good morning, participants, and welcome back to the session. We have our expert, Dr. Bala Chakravarthy Neelapu. He will be delivering the lecture. First, I will introduce him. Dr. Bala Chakravarthy received his BTech degree in Electronics and Communication Engineering from JNTU Hyderabad, MTech from JNTU Kakinada, and PhD from ACICH, Academy of Scientific and Innovative Research in 2018. Currently, he is working as assistant professor in the Department of Biotechnology and Medical Engineering of NIT Rourkela. He has authored more than 50 articles in SCI Index journals and conferences. Dr. Bala Chakravarthy is an accomplished author and editor, having contributed to high impact journals and co-edited the book Advances in Artificial Intelligence, Biomedical Engineering Applications in Signal and Imaging. Furthermore, his innovation is recognized through a US granted patent for the method and system for automatic volumetric segmentation of human upper airway respiratory tract. So with this introduction, I invite Dr. Bala Chakravarthy Neelapu to deliver a expert session. Over to you, sir.
Thank you, Abhishek. Thanks for the introduction. Thanks for the introduction. I hope everyone can hear me, right?
Yeah.
Thank you. So I'll just share my screen. And is it okay if I switch off my camera?
Yeah, it's fine. As per your convenience.
Okay. Okay, thank you. I will switch off and share the screen. I hope you can see the screen, right? PPT.
Right.
Is it visible?
Yeah, it's visible.
So slides are moving, right?
Yeah.
Can you see the change in slides?
Right.
Thank you. Good morning, everyone. As Dr. Abhishek was introducing me, myself, Bala Chakravarthy Neelapu, working as an assistant professor in Department of Biotechnology and Medical Engineering in NIT Rourkela. So, going to our today's topic. Today, I'll be discussing on learning more from less. I hope you should know what do you mean by this actually. Learning more from less, a path towards efficient representation learning with minimal supervision. Learning more from less is something like we have a very less data, but your training would be more efficient. Data in the sense here, the ground level data. Okay, we have very less labeled data, but your training would be more efficient than the supervised learning or something like that. In such a way, that's why we kept learning more from less, a path towards efficient representation learning, the minimal supervision. And I'm saying minimal supervision, it means to say that we have a very less labeled data. Okay, using less labeled data, we can train the large data and then we can come up with the similar or equivalent accuracy in comparison with the supervised learning approaches. So today's contents will be as like this: introduction to our supervised learning approach or semi-supervised learning approach, about semi-supervised learning data sets which we have worked on, and there will be one case study called as smart match, and then we'll go with some results and discussion. And I think domain adaptation is not there in this current session. I will see. Research question is, you can read this like, can weekly supervised or semi-supervised learning methods achieve clinically viable performance with limited annotations? See here, when I'm saying weekly supervised or semi-supervised. See, supervised learning, I hope you all know what is meant by supervised learning and what is meant by unsupervised learning. And here, supervised learning is the kind of learning where for every data set, we have labels. Labels will be or annotations. We can call it as annotations or labels. For the entire data sets, there will be certain kind of labels or annotations given, and based on those labels and annotations, we train the model, and then we get the results. That is called as supervised learning. Whereas unsupervised learning is for the entire data, the labeling is not done, and we run some of the unsupervised learning algorithms, and then we make it into the clusters, and we divide it into groups or divide it into classes. Okay, so that is for unsupervised learning. When we come for the semi-supervised learning approach, here we are discussing about the semi-supervised learning approach. When you are coming for semi-supervised learning approach, what we used to do is like, for example, if you have 100% of data, among 100% of data, for only 5% of your data is labeled, and remaining 95% of the data is not labeled. For example, 20% of your data is labeled, or remaining 80% of the data is not labeled. In such a cases, you can create a pseudo labels for the rest of the 80% of the data, and then we can train the model. Okay, so that kind of learning is called as semi-supervised learning approaches. Okay, so there are certain kind of advantages and limitations of semi-supervised learning approaches that we'll see in future further slides. And here the research question is like, you can make a, what do you say, you can just visualize the question like, can weekly supervised here weekly supervised in the sense any supervised learning approaches, okay, or semi-supervised learning approach which we are speaking about, can achieve clinically viable performance with limited annotations. Okay, having a limited annotations, can we run a semi-supervised learning approaches, and then are these semi-supervised learning approaches be clinically viable such that, or clinically reliable such that we can trust on these semi-supervised learning approaches, yes or no? That would be still a research question. Okay, so throughout the session we'll try to answer this research question. Okay, I'm going for the next things. What do you mean by semi-supervised learning approaches? See, semi-supervised learning, SSL, is something like, as we know that we have a data, and for every uh, point of data we have labels. Okay, and here, as I said, that there is no label, there is an unlabeled data, and for this unlabeled data we create some pseudo labels. Okay, for example, I said for 100% of data we have only labels for 20%, and for the rest of 80% we should create unlabeled data. For rest of the 80% of unlabeled data we should create a pseudo labeling. That we'll see how to create the pseudo labeling and all this. And again we go for the labeled data there, and then ground truth data used for supervised loss actually, and there will be some kind of 20% of the data which is labeled, and then we create assigning guest or assigning or guest, or we create pseudo labels based upon the knowledge of this labeled data. Okay, so that kind of approach of is called as semi-supervised learning, whereas 20% of the data is not labeled, is labeled, and the rest of 80% is not unlabeled. Whereas for the unlabeled data, we can create a pseudo label, and then we can train the model and then get the results. This kind of approach is called as semi-supervised, because 20% is supervised and the rest 80% is unsupervised. And the motivation, why we need to go for semi-supervised learning approaches, basically. The reason is like, what would be the motivation for doing this kind of semi-supervised approaches is, in the entire world we have abundant of raw data is available. Now, if we are going into the medical terms, in the medical data we have lots of medical data which is available in hospitals. In India, if we see, there are a number of hospitals, and whenever we go for the hospital they should take X-ray or CT or such kind of things, imaging related. If you see, they can take CT or else MRI or else X-rays. And where this data is going actually, all the data is available with these hospitals, but when will this data come into the for analysis, for this data analysis? This data will come for doing the data analysis when these particular CT or MRI or X-rays are marked or annotated by the experts which are who are in this particular field. Okay, so if they mark and then annotate, and then they give for some technical institutions like IITs or NITs or any CR laboratories. Then the scientists who are there, they can run their AI algorithms on these particular annotated data, and then they can come up with some kind of algorithms which are useful for these particular applications. So here what happens is lots of data is available, but do you think the doctors have enough time to do this kind of annotations? Okay, annotating x-rays is okay, fine, but when we go for the CT or MRI, lots of data, lots of time has to be investigated by these medical doctors, which is more precious for these medical doctors. So though the redundant data is available, they has to be annotated by the medical experts, whereas the medical experts time is more precious. So in that case, what we can do is still a question mark. That's why we go for this semi-supervised learning approaches. Annotation demands, here you can see annotations demands specialized knowledge and is prone to variability between annotators. Basically, see, if you wanted to create a ground rule, if one doctor is doing annotations, that is not enough. The reason being, one doctor, there could be some kind of bias. Okay, in such cases, generally for making a ground truth, what people used to do is at least minimum two doctors they will take, and the two doctors will annotate it with a different time span with anonymized data, and then the reliability between the doctors. A doctor also will not annotate one time only. The doctor has to annotate it two times with a gap of 1 week, so that if doctor has annotated the data two times in the span of 1 week, I mean with the gap of 1 week, then we can see that whether the doctor can reproduce the same annotations. Okay, whether he is able to reproduce whatever he has annotated in the first week. Is he annotating the data in a similar fashion in the second week? Is it reproducible by the doctor? Still a question mark that we can analyze. If it is reproducible, then we can say that yes, that marking can be trusted. Even if we see that we call it as intra-observer reliability. When doctor markings can be checked, when the reliability test is done between only the doctor for the first and second time marking, then we call it as intra-observer reliability. And between doctors also we have to check what is the reliability between two doctors, that we call it as inter-observer reliability. Okay, when this intra-observer and inter-observer reliability seems is to be greater than 0.9 relation, then it can say that yeah, it can be trusted, and from that we can generate a ground truth. This is the procedure how we generate a ground truth, or this is the procedure how we annotate the data in a medical, especially in the medical field. So for a doctor to mark one time, it is a difficult task. We are asking doctor to mark for two times, and we are asking two doctors to mark for two times. Then a lot of time has to be investigated by these doctors for generating these annotations itself. So if I ask doctor instead of 100 images, if I ask doctor to mark on 20 images, maybe it can take less span of time, and rest 80 images, we can create our own pseudo labels data. Such kind of thing can be done using these semi-supervised learning approaches. Reviewing the label data as slow and resource heavy process, obviously, yes. Okay, so this is the things, and why we go for semi-supervised learning approaches. As I said that if we can combine the data sets. Like if you have a small data set which is having annotations, and if you have large data sets which is not having annotations, we can combine these two data sets, and then we can generate the pseudo labels for the data set which is having a unlabeled data set, and then we can train the model. So in such cases, the semi-supervised learning approaches will be helpful, and this reduces the dependency. As I said that there is no less dependency. I cannot say no dependency. Less dependency on the experts like doctors, and exploit data structures. Sometimes you see exploit data structures in the sense, sometimes, for example, I give you one good example. Like if you, as you all may be students, uh, like if you are approaching, if you are going to do some exam actually in some subject like signal processing or image processing, if you are a BTech student, and if you know the syllabus, like yeah, this is the particular course syllabus, and then you may get questions only from this particular syllabus. Then what you will do, you'll take a textbook and you will just read to those syllabus topics, and then you'll come for the appear for the exam. Okay, so if I ask you, if there is no syllabus given, if I have not given any syllabus, then what you'll take this entire book, and you'll try to read the entire book, and then you'll learn more compared to the previous one. So similarly, if the limited annotations are given, and for the some datasets the annotations are not given, then our model will train more efficient than compared to the supervised learning. Similar, so it exploits the data. It will try to analyze each and every point in the feature map, and then it will improve, enhances model performance. I cannot say that it will be more, it will give the model performance better than the supervised learning approach. I cannot do that, but it will give in comparison with the supervised learning approaches. Okay. What would be the real world applications? As I said, that real world applications is like for diagnosing purpose in medical. Mostly semi-supervised learning approaches can be used in the medical applications, like rare disease diagnosing or something like fraud detection, where there is a huge data. See here, real world applications of semi-supervised can be anywhere in any application where we have a huge data and less manpower for annotating this data. Okay, less resources for annotations. So in such a kind of applications, any application, it can be semi-supervised learning approaches can be useful. And based on this concept, we have performed one semi-supervised learning approach uh, on detection of subtractive sleep apnea, and we termed it as a smart match here. And this work has been published in engineering applications for artificial intelligence. Recently, it has been published in 2025, and this is a semi-supervised framework for obstructive sleep apnea classification using single lead ECG signals with limited annotations. So here it is. We are using a semi-supervised for obstructive sleep apnea classification. Okay. So we'll see what do you mean by obstructive sleep apnea. I hope you are from medical background, but I don't know whether you know what exactly is obstructive sleep apnea or not. But I'll just give a brief description of what obstructive sleep apnea is. So obstructive sleep apnea is a sleep disorder. It's a sleep disorder when a person, mostly when a person is sleeping in this supine position. We call this as a supine position. When a person is sleeping in a supine position, and when the person is in a deep sleep, see these muscles which are holding the tongue, they also gets relaxed. When the muscles which are holding the tongue, they gets relaxed, the whole tongue falls on the windpipe. When the weight of the windpipe, I mean tongue, is falling on the windpipe, there is a partial blockage of this windpipe, which resists inflow and outflow of oxygen. Okay, so when there is a resistance for inflow of oxygen into the body, then what happens is like there will be automatically a signal sent to your brain saying that oxygen saturation levels in your blood are reduced. So somehow you should open the
Dr.
mouth.
Bala, sorry to interrupt you, Dr.
Yeah.
Bala.
Yeah.
Can you
Yes, yes, please
hide
go on.
this like this is a visible na time stop
Can
sharing
you
and
see that?
hide yeah, now it's fine, now it's fine.
Okay,
Please
thank you.
go.
Okay.
Thank you.
Oh, so so here you can see like when a person is sleeping in supine position, yes, there is a resistance for inflow and outflow of air, oxygen. So there will be a signal sent from to the brain, and the brain will the subconscious memory. It will be sent to the subconscious memory. The oxygen saturation levels in the body are being less, so somehow the inflow of air should be more. So this subconscious memory will send messages. I mean, will give a message to open the mouth, and the person will open the mouth and starts giving a gasp sound like and starts breathing using the mouth. Okay, that gasp sound is a kind of apneic event. Okay, and here most of the people gets confused with the snoring and apnea. One here you can say like one who is snoring hard doesn't mean that the person is having a apnea. But one who is having an apnea will definitely snore hard, very badly. Okay. Snore. So there is a slight difference between snoring and apnea event. The event is like when a person gives a gasp sound like and starts breathing, it is a kind of one event happen. Okay. So here that event is called as apneic event. So most of the people are underdiagnosed for obstructive sleep apnea. The reason is like when we are having a snoring problem, then how many of we people go to the doctor saying that we have a heavy snoring? No one, mostly no. So, so this remains undiagnosed. And what happens? What is it really a life-threatening disorder? Obstructive sleep apnea. Yes, I can say that it's a life-threatening disorder because we have seen in our lifetime, we have seen few people like they sleep happily in the night, and in the morning when they wake up, they say that the person is died or dead because of heart attack. Yes, the person might have done dead because of the heart attack, but why the heart attack? What is the cause of heart attack? Still a question. The cause of heart attack may be because of obstructive sleep apnea. When this windpipe is partially blocked or completely blocked, then the message has to be sent from the brain to open the mouth. Sometimes what happens is this message from the brain will not be sent, or brain in the sense subconscious memory will not be sent to open the mouth, and the person doesn't open the mouth for sleeping, and the oxygen saturation levels in the body will automatically reduce. As the oxygen saturation levels in the body reduce, it may lead for a heart attack. Okay, this is one of the most dangerous disease, which is 90% under undiagnosed. So mostly when I ask you, you have a snoring, then you go and visit the doctor, no one will visit. But if you have been provided a gadget, like something like an Apple Watch, provided a gadget and asked to wear this gadget and sleep, and morning you wake up and just check based on your snoring sounds or based on your ECG signals, and check whether you have an obstructive sleep apnea, yes or no. Then most of the people will use that, saying, okay, chalo, I have to buy only one gadget and then wear it and sleep happily, and morning wake up and see. If it is saying that yes, you have an obstructive sleep apnea, then you go and visit a doctor and take a treatment. So in such a domain, the people have started working from a long while. So for that, we have these are certain symptoms of obstructive sleep apnea: snoring, silent pauses in breathing, tiredness, insomnia, and concentration problem, memory loss, headache. All these are certain kind of symptoms, and complications would be something like early daytime drowsiness, heart attack, hypertension, stroke, memory loss, depression, insomnia, and all these things. These factors could be being a male. Don't it was something like funny. I can say like being a male. It's nothing like being a male is a very big risk factor. It can occur for the females also, but majority of these people who are facing this obstructive sleep apnea are male. That's the only reason why I kept as being a male. And being overweight, if you are overweight and obese, then it may lead to the obstructive sleep apnea. Being over 40, you should be more cautious after being 40. Have larger neck size and family history of having obstructive sleep apnea and having large tonsils. These are certain risk factors of having obstructive sleep apnea. Um, and then we'll see what are different types of obstructive sleep apnea. Here we have central sleep apnea, hyposleep apnea, and all these things. Obstructive sleep apnea, I hope you all know that I have explained. And less common than obstructive sleep apnea, the brain fails to send a proper signals to the muscles that control the breathing. This is called a central sleep apnea. Hypopnea is a condition where breathing partially decreases, not fully stop during the sleep. Okay, these are certain classes of obstructive sleep apnea. So when do you say that the person is having obstructive sleep apnea? There it can be like mild, moderate, and severe. Okay, when do we call this person as a mild obstructive sleep apnea? When do you say it's a moderate, and when do you say it's severe obstructive sleep apnea? Is like, for example, here this we can identify using this single lead ECG signals. Single lead ECG signals, whereas the person is asked to sleep under this sleep laboratory. There is one sleep laboratory in these hospitals. The person will be connected with a lot of sensors, like the ground truth for detection of obstructive sleep apnea is like gold standard. It's like polysmography. We call it as polysmography. Whereas in the polysmography, we take the signals from different organs of the body, like we connect EEG signals, EEG sensors, we connect EOG sensors, we connect EMG sensors, and we take the ECG, we take SpO2 levels. Like a lot of sensors will be connected for the human body, and ask the person to sleep happily for 6 hours or 8 hours. The person will connect all these lot of sensors and ask to sleep in the sleep laboratory. There could be a chance that the patient can be panic or may not have a proper sleep also. So, but however, we at the end of the day, when the person wakes up, the signals which we have been acquired within the span of 6 to 7 hours or 8 hours, these signals will be individually analyzed. Try to understand. ECG signal for 8 hours to individually analyze is really a tough task for the doctors. Okay. And not only ECG signal, we have to analyze the SpO2 levels, we have to analyze the EOG, we have to analyze EEG, EMG, and all these things we need to analyze. And based on these, doctors has to conclude whether the particular person is having obstructive sleep apnea or not. If the particular person is having obstructive sleep apnea, how many events have occurred within the span of time, within the span of 7 hours? Okay, how many events have occurred? And based on these events, how do you classify whether this particular person has a obstructive sleep apnea, whether it is a severe or it's a moderate or mild? So for that, what these people have done is, for every 1 minute, for example, in 1 hour of span of time, we have 60 minutes. For every 1 minute, they calculate that whether the event have happened or not. Okay. For example, in 60 minutes, there will be 60 events. If the person is having 30 above events as apneic events, okay, as 30 above as apneic events, then it is considered as a severe obstructive sleep apnea. If the person is having between 15 to 30 out of 60, 15 to 30 as a apneic events, then the person is considered as a moderate obstructive sleep apnea patient. And the person is having 5 to 15, then it is treated as mild, and less than 5, it is treated as a normal subject. Okay. So for that, what instead of connecting a lot of sensors, we still can we identify the obstructive sleep apnea based on single lead ECG data? The people have worked on it, and they have published one data set called as apnea ECG database, which is publicly available in PhysioNet database. Okay, this database is published in 2000, I guess. It's a grand challenge in 2000, year 2000. So what they did is they have given 35 patients data. On each patient is having patient or subjects data, where 35 subjects are having nearly 6 to 7 hours of ECG readings, single lead ECG readings, whereas every minute is recorded as an event as apneic event or non-apneic event. Okay. So for example, for an average, if you have taken 7 hours for a subject, okay, we'll have a 7 into 60, so 420 events will be there for the each subject. So similarly, we have 35 subjects here. Okay, among these 35 subjects, we have mild, moderate, as severe, as well as normal subjects data also is there. So after a few people who have performed better training on this, then after a few days, they have released the test data of again 35 patients, which is a bit complicated compared to this training data set. Total 70 subjects data is available, whereas males are 57, as females are 13 subjects. Okay. So using these data, we have created, see here, every ECG signal, we have, what we did is we have used we have applied, what to say, time frequency domain operation on this ECG signal of one event, like one event is just 1 minute data. That is what we did is we have performed a Q transform on that, and then we converted it into images, and then we have trained it for our semi-supervised learning approaches. Okay. So for apneic events, for this particular data set, we have 476 images. Whereas for training, we have testing, we have 5,491 images. Total, these are the number of images which we have. Okay, total 32,660 images we have. Okay. So all this was annotated data. And there is one more data set called as MIT PKH polysmographic database for the binary classification. In training images are 2672 or something like this. This is the demographics of the data which is available. Okay, and here in this particular database, we can see there was some class imbalance. Okay, we are supposed to address this class imbalance problem also in this particular data, but here we don't have that much of class imbalance. Okay, and here in the MIT BIH database also we have a multi-class classification also. As I said, that central apnea, hypopnea, obstructive sleep apnea. There are 3 different classes. Okay, and then how here when I'm speaking about data, this particular data is nothing but a single lead ECG data. We are speaking about single lead ECG data. Here you can see that this is something like ECG data only. This is an ECG data. So what we did is initially we have done some pre-processing algorithms. We have applied some pre-processing algorithms on this ECG data, such that to remove these outliers from this ECG data of total 70 subjects apnea database, and we divided it into 1 minute segments. Yes, and then we applied a bandpass filter with a lower cutoff frequency of 1 Hz to the higher cutoff frequency of 45 Hz. This band, whatever the low pass filter I guess we used, whatever band pass filter we used, and then once we are done with this, then we applied some constant Q transform. This is a time frequency domain graph of this particular signal. These are the constant Q transforms. And then on this constant Q transform, what we did is we have applied what is a deep learning algorithms. And here there is one more algorithm for removing the outliers. Not only this bandpass filter, we have used some more algorithm which is not currently not presented here, but there is an algorithm for removing these outliers. Okay. Currently, try to understand that we have generated a constant Q transform images, and then these constant Q transform images are fed to our deep learning model or smart match algorithm. Okay. So coming to the smart match algorithm, try to understand the primary intuition for our smart match algorithm. Is our primary intuition. This is just a primary intuition. It is something like there is some kind of leader. Okay, main person or leader or a class teacher. You try to understand. If I say the person who is teaching you a class, okay, and what the leader or a teacher will do is will create certain kind of rules, okay, to maintain the class in a proper way or else to give some lecture. Okay, so similarly, the leader will generate some policy formulations and disseminations, and then ask these followers to follow. And this in these followers, there may be 2 types of followers. One is followers, and the other one is non-followers. Okay, one is a good student, and the other one is a naughty student who doesn't follow the lectures of a teacher. Okay, so what is the role of these followers is that they take the concept from or the policy formulations and disseminations from the leader, and then they try to analyze these formulations in a better way, in a positive way, and if there are any limitations associated with this, such a kind of limitations will be reported back to the leader. It means to say that we get a feedback, but it is a positive feedback for enhancing this leader model. Okay, for enhancing the leader model. And what these non-followers do, these non-followers will try to yes, any more questions? Oh, okay, I can continue.
Yeah, please continue. Please continue.
Okay, okay, thank you. So here we have non-followers. Non-followers are something like a naughty students who will not follow the teacher. Similarly, they don't follow the policies given by the leader, and they, instead of not following, they create hurdles for this, and they try to influence the followers also. Influence followers' decisions to reject the leader's policies, disrupting the compliances and generating negative feedback. They try to give a negative feedback also. Okay, so and this later what he'll take the followers feedback and try to modify these policies in a different way. Though the negative followers, non-followers are giving a negative feedback, still they try to what you say compensate these negative followers, and they create their formations. And these followers, though they are being influenced by non-followers, they don't get influenced, and they take the way they are influencing these followers. They take it and they give it the feedback for the leader, and the leader will keep on updating the policies. Okay, this is the primary intuition basically. If you can understand this primary intuition, then you will try to you can be able to understand the smart match model also. Okay, this is the entire methodology of our model which we have generated, and we call it as smart match. Okay, and here what you can see, like here we have a raw ECG data, non-apnea or apnea events. We have only two classes in this case. We worked only on apnea database. We did not work on MIT BIH database. Okay, so here we have two classes, apnea and non-apnea. And for this raw ECG signal, we converted it to time frequency domain graphs like constant Q transform, and then this constant Q transforms. Here I said that this is a semi-supervised learning approach. In the semi-supervised learning approach, only 20% of the data will be labeled, and the rest of 80% of the data is not labeled. Okay, so for example, if you have a 20% of the data which is labeled, there here we can get a features better way for knowing for these particular classes. Okay, as here you have a green in the diamond and red in circle. Green and diamond could be of one class, and red in circle could be of other class, whereas the red and green denotes that they are properly labeled. Can you hold for a minute? Just I'll get back to you.
Sir,
Yeah, please.
So 27, 28, if you have an excellent window subjects, like I want to.
Yeah, Dr. Bala, you can unmute yourself if you are speaking. Dr. Bala, you are on mute if you are speaking.
Okay, you can hear me now.
Right. Yeah, we can hear you.
Okay, thank you for informing me. कब से unmute है मेरा? अभी just
No,
now.
no, actually, I think some student came to you and you were discussing, so
Yeah.
that time.
Okay, okay, fine. In that case, fine. Not a problem. So here, yeah, here we have, you can see these labels or this data space, circles or diamonds, they don't have any fill inside that, which mean to say that we wanted to say that this is unlabeled samples and these are the labeled samples. And here we apply some augmentation techniques, weak augmentation, and then we give it to the later model. And the later model, it is this entire A, you can see that this dotted space entire A block is some kind of some supervised learning approach on 20% of this label data. This is kind of supervised learning approach. And from this supervised learning approach, we get some kind of knowledge distillation, and we give it for the follower one, and then for unlabeled samples data, we give for weak augmentation again, and then we give it to the follower two. Follower two will generate an adversarial attacks, like try to keep some kind of noise in these images or try to corrupt this data in a different fashion, and then that will be provided to the follower one. So at the follower one, we get the data from the supervised learning approach, and we get the data from the follower two, who has generated an adversarial attacks. Okay, and the follower one model has to take the data from the supervised learning approach and we'll take the data from this, and it may follower 1 has the knowledge of this proper labeling. So the follower 1 will try to create a pseudo labels for this. Okay, based on the knowledge which has come from the follower 1, and based on the knowledge received from this follower 2. Okay, we'll try to analyze the data which is received and try to generate a pseudo labels, and the pseudo labels will be generated, and then it is given for the deep learning algorithm and for the further training and for classification. Okay, this is the entire approach. Okay, we'll see one by one. Okay, so here you can see, like, for supervised learning approach, as you have seen in this primary intuition, this is the leader. Okay, and here these followers, positive followers are leader 1, the negative follower is leader 2. Try to understand here in this diagram. Okay, leader model is nothing but your class teacher. Okay, and follower 2 is the naughty student, and follower 1 is the good students. Okay, so follower 1 for good students takes the knowledge from the teacher as well as from these people, but they will not follow whatever these people are giving. They try to enhance the things, and then they create a pseudo labels for these particular data sets. Okay, so supervised learning, as you all know, that there will be label samples, obviously, yes, and we are do the weak augmentation. There is no noise, and then it gives to the later model. What is the later model? We'll see in further slides, and then later model will classify it into the FNIA or non-FNIA equivalents. Okay, or it will create a feature space, basically. It's a feature space representation. And for the follower 2 is kind of naughty students who doesn't follow. So here we have unlabeled sample space for them, and then we give a weak augmentation, and then that is given for the follower 2 model, and follower 2, based on this data, they will try to give generated adversarial attacks. So nothing but some kind of, what you say, noise associated. They create certain kind of noise in this one, and then they create a feature space, and this feature space is given for the follower 1. And follower 1 will receive that data from both leader as well as from this follower 2, and then they will give an adaptive temporal ensembling and temporal consistency loss, as well as adaptive batch hard mining. They will do this in the process of generating a pseudo labels, basically. And then I will explain what is adaptive batch hard mining in the further slides. Okay, and adaptive pseudo labeling will happen, and then once the pseudo labeling is happened properly, then we give it for the our leader. Follower 1 model will do the apply this, what is it, deep learning algorithms for classification, okay, or generation of the feature maps. Okay, so here you can see how to generation of pseudo labeling, basically. This is the way initially this certain kind of input samples without having any labels. Okay, and then based on certain thresholds, global threshold for the entire classes, and there will be a class specific threshold. Based on the thresholds, we give a randomly we give labels for this, and then we apply batch hard mining. Okay, I'll tell you what is a batch hard mining. And batch hard mining is a process of enhancing or improving these pseudo labels which are generated in this particular step. Okay, it's a process of an initial step. It's a process of enhancing or refining these pseudo labels in a proper way. And then there will be certain kind of, what is it, thresholds based on these outputs received over here. And then this is a cyclic process, keeps on repeating. And when these pseudo labels have achieved the resultant threshold, then we stop the process. And here you can see, like, this circle, which is thickly red, darkly red, you can call it as confident pseudo label. So yeah, you have 100% confidence, or some good strongly, you can confidently say that, yeah, this particular pseudo label has been strongly assigned. Okay, and when you can see, like, partially red inside, so you can say that less confident pseudo label 0. Okay, for label 0, I mean label 0 is class 1 and class 2, something like that, or class 0 or class 1. Okay, this is for the green rhombus is for the class 1. Okay, so this is the process of generating a pseudo labels. But we'll see what adaptive batch hard mining is like. feature vectors representation of different classes. For example, if the vector representation is in this fashion, and then we selection of top one hard positive and hard negative samples. Basically, here there will be an anchor sample selected from class 0. For example, if you have selected an anchor sample from the class 0 and rhombus shape with the red color is class 0 and circle with the green color is class 1. You can select, and we have a hard positive samples of class 0 and hard negative samples of class 1. Here, what do you mean by here we are going to select top 1 hard positives and hard negatives, top 2 hard positives and hard negatives, top 5 hard positives and hard negatives. Here, hard positive means it is a positive sample. If you are seeing it for a class 0, then it is a positive for class 0, but it is representing as a class 1. It is hardly positive. It is positive, but it is representing as class 1. You understand? It is representing as a sample negative. So for such a kind of samples, we identify and then we give a label of class 0. Okay, it belongs to class 0, but it is representing as class 1. So we identify such a kind of hard positives, and then we identify such a kind of hard negatives, and then we give a pseudo labeling for that such kind of hard positives and hard negatives. So it is something like the people who in the classroom for example, if you are sitting for the classroom of what is a BTech first year, but BTech second years are coming and sitting in your BTech first year classes, then we find the people who are looking like maybe they are looking like at the age of first years, but they belongs to second year. So we find out them and then we throw them into that particular class. Similarly, we have to identify the positives, but they are looking hardly, they are looking in the negative area. So hardly positive. So we identify such kind of hard positives and hard negatives using this adaptive batch hard mining. In every iteration, we identify the hard positives and hard negatives, and at the end we come up with the most confidently identified pseudo labels. Okay, and this will pseudo labels will be given for our later models. Okay, so here we have our later models as well as the later model and follower models. You can see like follower model and later model. Here it is blue lines, which are, you can see the blue lines. They are this is entirely a later model. You can see like input tensors and deep feature extracted for the later model. You can see like here you can see what is the convolution layer, dense layer. I hope when you have come to this part, you could understand all these layers, dense layer, attention block, addition matrix, and all these things should be known actually if you are in this deep learning concepts. So this is your data model given, and here we have used some attention mechanism also that we'll see in the next slide. Okay, this is for the later and follower model. This is the channel attention mechanism which we have used here. We have used attention blocks, these blocks, and this is attention mechanism. This generally we give an input tensor and then we reshape it into the tensor, and then we give a channel attention and layer normalization. Here we have a query key and values. Based on this query key and values, we come up with this gated attention, and then we get an output tensor. Okay, this is general attention mechanism only which we have used. Okay, so our entire model is completed, and we have certain evaluation matrices, metrics like accuracy, precision, recall, and all these things are, I hope you know, based upon the true positive, true negatives, and false positive, false negatives, you can come up with these formulas. So quantitative study, basically when we applied it on AICIH data sets for a binary classification, and we have trained only 20% of the label data, only 20% of the label data, and though we have 100% of label data, but still we have given only randomly selected only 20% of the data, and we have given the labels only for that 20% of the data. Then when we run our smart match algorithm, we have received an accuracy of 91.99. Okay, and for MIT BIH data for binary class, what happened is when we have run 20% of the label data and we received an accuracy of 80.70. For multi-class, we received an accuracy of 84.88. Okay, this is a, so here you can see, like, for example, you could ask me a question, why it is only 20% data, why not 30, why not 40, or why not 10, something like that. We have randomly chosen. In the literature also, we have seen majority of the people are working with 20%. So similarly, we have taken 20%, but for that we have done some kind of analysis, like if 100% data is labeled, we have received an accuracy of 92.64, and if 1% of the data is labeled something, we received an accuracy of 83.36. Similarly, 20% of the data is labeled and 80% is unlabeled, we received an accuracy of 91.99. If we compare this 2080 relation with this 100-0, you can see, yes, in supervised learning only we are receiving a better accuracy compared to the semi-supervised learning. But here we need to understand that we have to compromise a little bit of accuracy if we wanted to reduce the huge burden of this annotation. See, annotating on the 3,346 images and annotating or doing annotations on 16,734 images is different. Okay. So if we could and the accuracy, if you see, like 91.99 and 92.64, hardly it is 0.65 difference. Okay, so if we could compromise little bit accuracy, then we can get a better, what is it, we can have a huge redundancy in your manpower. Okay, this is what we can observe. Even this 80% of the data is not necessarily needed to be labeled. Okay, so similarly, we have compared our algorithm with the smart match algorithm with many of the existing semi-supervised learning approaches. These are the certain semi-supervised learning approaches which have published recently, and this they have worked on different dataset, not on our apnea dataset. But what we did is we have implemented these algorithms which are existing, and then we applied it on our dataset, like what is the apnea dataset, and then we have outperformed, even the smart match has outperformed most of the state-of-the-art algorithms for 20% of the labeled data. You can see, like 91.99% we have received. And here you can see, like there are certain articles which have certain people who have worked on this apnea database only, where they have used different approaches other than this our smart match approach. They have used some other approaches. They have taken the deep learning algorithms only with extracting different kind of features. Okay, and we can see that our algorithm smart match has outperformed most of the state-of-the-art algorithms for this particular application. Even whereas all these algorithms which we have shown over here, 21 to 2024, but all the publications have been done so far, they all are on supervised learning approaches. But however, this particular article has got 92.10, but our algorithm has got 91.99. But ours is trained on 20% data, whereas all these algorithms have been trained on 100% labeled data. 100% labeled data. So sometimes we can see that our algorithm has even outperformed some of these supervised learning approaches, which mean to say that our follower model as well as the leader model or follower model are a bit stronger compared to these algorithms. Okay. So here we could see, I'll show you some ablation study which we have done. See here, M0, M1, M2, M3, so on to M7. All these are certain kind of modules in our in this particular model. You can say, like here M0 without any augmentation. I mean to say that there is no, here we have applied weak augmentation. If you are removing this block and running the entire thing same, what happens? What would be the result? If you don't have this weak augmentation and we run the entire thing same, what would be the result? Without any augmentation. Okay, then we got an accuracy for 20% labeled data. We got an accuracy of 90.57. And M1 with strong augmentation. Here we have used, in this model, we have used weak augmentation basically. Instead of weak augmentation, if we can use smart augmentation, smart augmentation instead of weak augmentation, then what would that be like? Okay, we received, we have used strong augmentation like smooth, then we have got an accuracy of 88.25%, and M2 is without follower 2 model. If you are not having these adversarial attacks, then what do you get? Something 91.30 without adaptive batch hard mining. Adaptive batch hard mining, I hope you know this. Adaptive batch hard mining is there at this particular point, and if you are not having that adaptive batch hard mining, then what would be the result? 91.50. Without adaptive temporal ensembling, without something like that, temporal consistency loss without constructive loss. So if what do you, if certain parts of or blocks are missing, then what would be the results? You can see like, and which mean to say that all these blocks are contributing in our smart match, which mean to say that as the accuracies are decreasing, it means to say that all these are having a strong correlation with our smart match. So we need to include all these blocks in our smart match algorithm. So here, this is also one Wilkinson's pair comparison p-values for model performance across the different ablation studies, like M0 to M7. You can see like how strongly significant they are. Like most of the blocks are strongly significant. You can say like most of the blocks are having p-value less than 0.05. Okay, so most of the blocks, all the blocks are highly significant. And these are wanted to study things like comparison of test accuracy and epochs for various training levels. So these are the test accuracy and accuracy, how our test accuracy is good. Like just results of confusion matrix with the accuracy and epochs plot. Okay, and this is a TSNA plot for the ECG. And here we can see like silency maps, like we said the attention mechanism we have used, right? So here, if this is the original image and this is a silency map, it is something like where our algorithm is paying more attention towards our on the image. There are certain parts which where in these particular parts our attention mechanism is working well on this particular what is say images. Okay, this is for the apnea class and this is for the non-apnea class. And for domain adaptation, I think we have not only performed this in apnea database, we have used the same smart match algorithm for ham 10,000 skin cancer database also. And when we have used on this particular database, whereas for 20% of level data, we received an accuracy of 91.58. Which is bit clinically reliable accuracy. Okay, that's what we receive. And for this for the skin cancer database, and we used it for brain tumor detection also, whereas we used it for brain tumor CT data, and then we received something accuracy of 98.84 plus or minus 0.05 standard deviation. This is what we received. This is for previous one is for CT and this is for MRI also we used, and we received an accuracy of 99. This is for smart match, even 20% it is trained. I mean label data is trained. 99.50 is issued with 0.03 as a standard deviation. What are the challenges associated with semi-supervised learning approaches? Are like bias amplification, incorrect pseudo labels can reinforce errors. If there are certain kind of errors associated in this particular what is it pseudo levels generation, then it may lead to the errors. So pseudo level generation is the main important point in our semi-supervised learning approaches, which we have to pay more attention towards that. And performance specificity and sensitivity effectiveness depends upon the label data and quality. Algorithm is, yes, do you think the algorithm will be less complex compared to the supervised learning approaches? No, never, because we need to generate a pseudo levels for that. Because of that, the algorithm complexity will definitely increase because of generation of the pseudo levels and then train the data. So though the algorithm complexity is increased, the human intervention will be less because for generation of this label. That is the advantage of semi-supervised learning approaches. And data distribution mismatch leads to poor results. If you have any incorrect data distribution, then it would be leaning for approved results, as well as hyperparametric tuning, often more complex than the supervised learning, obviously. Yes. Okay, these are certain challenges for and considerations in semi-supervised learning approaches. And from this, what we could say, like in the study aimed at reducing the reliance on expert-driven annotations and utilizing unlabeled data efficiently in medical imaging tasks. Basically, um, the major thing of semi-supervised learning approaches is like we reduce the expert-driven annotations. Okay, reducing the reliance on, or like we are making an algorithm such a way that there is less dependency on experts-driven annotations. Okay, and semi-supervised learning framework achieved per segment classification, high accuracy, and recall. We have received from this particular what is a case study also. You could say like even sometimes our semi-supervised learning approaches has outperformed the smart batch has outperformed some of the supervised learning approaches also. It doesn't mean that semi-supervised learning is better than supervised learning. It doesn't mean that the state of the art algorithms are a bit less complex compared to the our smart batch algorithm. I mean to say that. Okay, so if you wanted to go for semi-supervised learning approach, we need to compromise for bit accuracy, but it will reduce the huge manual intervention or expert intervention. The adaptive batch hardening technique to reduce interclass variations. All these are certain kind of conclusion ablation study demonstrate that it surpasses the recent SSL based approaches. Even our smart match algorithm, which we have discussed, that has even outperformed some of the existing semi-supervised learning based approaches also. Going to say that. Okay. Yeah, this is the article which we have published in Engineering Applications of Artificial Intelligence in 2025. We have published, and here Somjit Gyan, he is one of my PhD students. We have Nalla Maheshwara, Deepak Kumar Sahu. These three are PhD students of mine who are working in our lab, and they are the strength of this particular laboratory. And they are working for basically Somjit Gyan. He is working on his PhD thesis. This is one of these PhD outcome, and we have the remaining are the faculty who are working over here. And these are the few references. Okay, I'd be happy to take questions from your end if you have any questions. And thank you. That's it for today.
So participants, if you are having any question, you can directly ask.
We have a 10 minutes time, I guess. You can go for questions. Anyone, if you are not able to speak, then even you can message me in the group. I can say like you can give a message over here. I can respond to the chat with you. Okay. You can hide the dialog. It's okay. Okay, hide the dialog. Acha. Okay, fine. Any more questions from your end?
Okay, I think there is no question. So thank you, Dr. Bala. Thank you for delivering such a nice lecture and explaining the sleep apnea and signal processing, deep learning, and many other techniques. So thank you. Thank you for delivering a lecture. Thank you.
Thank you, Abhishek. Thanks for inviting me for this lecture. It's nice speaking to you. I would be happy if someone could ask a question. If not, no issues. No, maybe no questions. Fine. Yeah. Yeah. You can ask a question. Go on. You're not audible. If not a problem, can you type it? You're not audible.
Anybody is asking a question?
No one. Okay, fine. Abhishek, you are muted, I guess. Abhishek, you are muted.
Okay, thank you, Dr. Bala.
Thank you.
So participants, now this session is over now, and next session we will start by 11:30. So there is a short break. So we will get back to you by 11:30.
Okay, Abhishek, I can leave this.
Okay, thank you.
Bye. 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 Thank you.